Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Okay, welcome back to Healthy Living Tuesday right here on Extra Now. Dr. Jitka Lom is here, as she is every Tuesday, from Express Care, and she is going to talk to us about another aspect of medicine. Doctor, welcome back.
Thank you.
Okay, do you have a nice Labor Day?
Thank you very much. Yeah.
Okay, so tonight we are talking about something, ADHD. It's very often spoken of and spoken about, but I'd say probably the layman out there, they've heard maybe the Hollywood definition of it, but they don't really understand truly what ADHD is. So exactly what does that misunderstood acronym stand for?
Well, it stands for Attention Deficit Hyperactivity Disorder. And basically there's two components to that disorder, one being concentration, attention, and the other being impulsive or hyperactive. And it's typically diagnosed in children. It has to have started before the age of 7. Usually in very young children, by the age of 2 or 3, these traits can be identified. And it basically leads to difficulties in school performance, difficulties interacting with other people because of the impulsivity and the hyperactivity that the children exhibit, and the difficulty they have concentrating in school.
Mm-hmm. Now, is it just caused maybe by just excessive electricity in the brain, or just, you said an inability to focus and to concentrate?
To focus, right. So we all have parts of our brain that help us focus. So if you, for example, thought for 10 seconds, just look around the room, spot everything that's blue. Blue, 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 blue. You're looking around the room. You can identify all those things. That's a part of your brain that is helping you to focus on that. Then if I ask you, what's red? You will have missed what's red in the room because you're focusing on what's blue. Mm-hmm. Now, a child that has attention deficit hyperactivity disorder will be seeing the whole picture. They'll be seeing the red, the blue, the green will be coming at them. All the different colors, for example, in this room will be coming at them. And they'll have difficulty separating and focusing on one thing in particular. Unless that thing is very interesting to them, or unless they're in a one-on-one situation, or perhaps it's very new, those things will be more easy to focus on. But something like math problems that are very repetitive and boring, maybe, for a child, will be more difficult for them to focus on.
Now that's an interesting point, Dr. Lom, because obviously this affects young people when they're in their formative years, and this can basically affect the ability to learn. Is this something that people can grow out of as they reach maturity, or will it hurt their social interaction skills as they grow older?
Sure. So it depends on the child and it depends on the severity of their case. Many times people develop coping skills, okay? So they'll develop tricks, they'll write themselves little notes, they'll develop ways of organizing themselves, and they'll get cues from other people. They'll learn how to read social cues from other people so that they can curb their impulsivity and deal with those situations better. So can they grow out of it? They can adapt better, but they'll always have those traits. Mm-hmm. Yeah.
Okay, now let's talk treatment. I know there are many popular medications that, again, like in Hollywood, they throw these around, like so much confetti, but how typically is ADHD treated?
Well, again, it depends on how severe it is. In some children, it's extremely severe, and they really need medication, just the way that a child who can't see needs glasses to focus. Mm-hmm. Other children need medication to help their brain focus. But other children may have just mild traits, and they can do well with just behavioral therapy, helping them to become better organized, helping the parents and the teachers work with them more one-on-one, just changing the system in the school, changing the system at home to help them be able to adjust better.
Okay. And once again, like as children grow up and everything like that, it is something that they can train themselves to be better adapted and everything. But as you said, this is something they basically will have with them for a while.
Yeah, and there are adults that have ADHD as well, and they've been diagnosed later in their life and do benefit from medication.
Okay,
but they can develop coping skills and often do.
Okay, I was going to ask about that later, but tell you what, we have a bunch of really interesting questions that our Facebook community posted and everything, but we will get to that when Healthy Living Tuesday with Dr. Jitka Lom from Express Care continues right after this.